Hello everyone, I am Dr. Urmi Shah. I am working as a cardiac physician in Epic Hospital. I have done my MD, DNB medicine and now practicing cardiac medicine. Today's topic is understanding hypertension. Now for understanding hypertension, we should all know what is blood pressure. So everyone should have a healthy, normal blood pressure. Now what is a normal blood pressure and what is blood pressure? With each heartbeat, the heart pumps blood into the blood vessels and the pressure created on the walls of the arteries creates blood pressure. The normal blood pressure is 120 over 80 mmHg. 120 is the systolic blood pressure and 80 mmHg is the diastolic blood pressure. The systolic blood pressure means when the heart contracts and the diastolic pressure means when the heart relaxes between the heartbeats. Now, when this normal pressure remains persistently high, it is called as hypertension or the high blood pressure. Now, there are certain factors which are responsible for high blood pressure. For example, age. Age stiffens and narrows the arteries and thus resulting the heart to work with more pressure. Second is a family history. If one or more two relatives in the close proximity have, then genetically acquired hypertension can occur. Third is alcohol consumption, there was smoking, chewing, etc. also can lead. Obesity, lack of physical activity are also some of the reasons. A lot of emotional stress in today's life is also one of the very important reason in causing hypertension or high blood pressure in today's era. Now, how should we overcome and how should we know the symptoms that the patient is having high blood pressure? Blood pressure or hypertension, high blood pressure can be a silent killer because it may not have any obvious symptoms. But certain times the patient presents with symptoms like headache, nausea, vomiting, blurring of vision, etc., dizziness, left arm pain also can be one of the symptoms. Now, considering these symptoms, the patient should consult his family physician or a nearby hospital and target to get the blood pressure checked. Usually, the blood pressure is checked by an instrument called the sphygmomanometer. But nowadays, after the COVID era, sphygmomanometer, instead of sphygmomanometer, people started using self-monitoring system and digital monitoring help. Now, the factors which I have put in line, like age, nothing can be done much about that. But other factors like smoking, tobacco, alcohol, such vices can be stopped. Regular exercise helps. For example, if regular exercise, it makes heart healthy and it helps the heart to work less to pump blood into the vessels. This causes control of blood pressure. Food habits can be corrected. For example, processed foods have excessive of sodium content. Less salt can be consumed in the routine diets. Foods like fruits, vegetables, excessive in potassium or rich in potassium should be used. These have a term called DASH, that is dietary approach to stop hypertension. If this therapy is used, we can reduce the blood pressure by 11 mmHg. That is quite a big number. Every teaspoon has 2300 milligram of salt in it, of sodium in it. So by reducing that also in the diet, we can reduce the blood pressure by at least 5 to 6 mmHg. So considering it that control of blood pressure is of utmost importance, because if we don't do it on time, we can land up in serious complications like cerebrovascular complications, example stroke, kidney diseases, kidney failure, blindness, also cardiac diseases like heart attack. So considering the mortality and the morbidity with high blood pressure, we should consider that and keep our blood pressure under control. Adherence to the family doctor is also a must by self-monitoring or by visiting him frequently as you are diagnosed with high blood pressure. Target your blood pressures to be 120 over 80. More blood pressure can cause more harm. So the takeaway message is keep fit and healthy. Healthy is a precious moment in life for our loved ones. So try to remain fit, try to remain healthy. Thank you so much.